Here today with Ricky Choi. He is the head of digital health at Samsung Electronics America. And Ricky, you just finished talking to the group today here at the HITLAB. Tell us a little bit about your presentation and how it was received.
Absolutely. So, I'm a physician and have been practicing almost 20 years now. And, a little while back, I noticed in my clinics, my primary care clinic, that I had patients who had a lot of needs. They had medical needs, but also they were low income and had a lot of social needs as well. But what was really interesting was that every single one of them had a smartphone. They might not have had enough money for Christmas presents, but they all had smartphones. And I had this aha in my mind that said, oh, okay, there's something about some of these technologies that are fundamental enablers that everyone kind of needs, whether it be to go to work, to go to school, to connect with your friends and family. And so an opportunity came up to join Samsung Electronics, which was a big right turn for me, again, primary care doctor, and decided just to make that jump because I thought I needed to see this through because I was really interested in trying to figure out how do we drive health improvement in an innovative and scalable way. And so here I'm at Samsung and we're trying to figure out exactly that. Our vision is to improve and to build a healthier future for everyone around care, connected care that's centered around the home.
Okay.
And if we think about, the technologies that are in your home today, and other technologies that are available, that are in many people's homes, I think there are a lot of key components that can come together to really help improve health. And so if you think about Samsung, for example, we have refrigerators, obviously, we have vacuum cleaners, we have televisions, smart rings, all these wearables and sensors. We also have Internet of Things. We have an Internet of Things platform. And so when I look at that, I think, how do we connect those dots to help people live healthier, understand their health needs, help them achieve their health goals, tie them to care when they need it, care for their aging parents, care for their kids. I think the opportunities are endless. And we're talking about through technologies that people generally know how to use, that don't scream, I'm frail, I'm sick, and can really make a tremendous impact on people's lives.
You're encouraging an entire rethink of an entire company. Really. I mean, this is about as revolutionary as it gets. I mean, companies make things and sell things to people, and then people use them. You're talking about an interconnectedness for health benefits. How does that go over?
Yeah, I think that, if we take two steps back at an industry level, those are traditionally hard things to do for manufacturing companies to go into kind of software services. But I think that at the highest levels of the company, there's a recognition that that is absolutely required. And many companies have and are doing it today. I think that healthcare is always kind of an attractive industry just because of the amount of money that goes into it.
Right.
But everyone understands inherently how important it is. And so whether it be their own health conditions or caring for their aging parents, I think it's something they're aware of. And so what are the things that we can do in order to try to make those things easier? I think that all companies do this, and we're no different. We start from what we're really good at. Some of those devices and technologies, continue to advance them to make them more accurate, ever more meaningful, solve problems, and increasingly go into kind of services in various ways that people would really value.
But your way of thinking had to be a little bit of different, at least going in, because you're just looking at the world differently than the people who were running Samsung. So how were you able to get people to either come around to the way you thought, or how were you convinced, or did everybody kind of meet halfway? I'm curious about that.
Yeah, that's a really good question. I think there's always a couple components. I think the first thing is the right leadership. We need to have the right people who understand what we're trying to do and are confident and are bullish and bold to go after it. I think, and we have that right leadership structure in place. The global head of digital health is actually a dermatologist who has been in health IT for a long time and understands healthcare and the healthcare system. I mentioned the dermatologist part because they're one of the earliest specialties in telehealth, and so they understand. He understands. The role that the opportunity that there is. I think that as there is a drive and demand to continue to grow as a company, and we see this as a potential growth area. And with any organization, there always has to be about finding the right win-wins, right? And so as we make this continue to grow in this different direction, I think there's going to have to be a prioritization of meeting the core business needs, the way the business is currently built, which is selling things,
right?
But starting to add on the value on the service aspect of it,
right?
And then if we do this really well, which I think we can, then we are able to promote that as the primary business eventually.
Are you allowed to talk much about what you're starting with and how that's performing?
So we have done a number of things in the past. We had that home-based cardiac rehab program, which we've had tens of thousands of patients complete with a partner healthcare system. We have already launched from our Smart Things platform technologies where it helps support aging in place. So, for example, especially thinking about the needs of caregivers. So imagine you're aging a parent, turns on the stove, forgets to turn it off, right? Then the caregiver, the adult child, has an alarm on their phone saying, hey, the mom left the stove on, right? Or other safety measures, fall detection, right? Thinking about slips and falls, major factor when it comes to it's about declines in healthcare as key points of where there's significant declines in health. So some of those things are in place, but we're looking at a broader vision, and we've built out a strategy, and we're going to start to show that some of the things that we're going to be doing in this general space over the coming months.
So how promising can this be?
Well, I think the need is obvious. We think about the aging population, the size of the aging population, the increased interest of people wanting to not only age at home, but receive healthcare at home. But we all know that not all needs are always going to be successful businesses when they're met, right? And so I think that when we talk about digital health, in many ways, I still feel like we're early. It feels like we've been talking about this 10, 15 years, right? Maybe even longer, but it's still somewhat early, right? And so I think it's going to be about creating solutions that meet needs, that also then have the right business model behind it today, but is also built for the future when we think about more value-based care. Finding that right balance of direct-to-consumer and B2B2C, so to speak, and other ways in order to find that right mix. I'm hopeful. I don't think anyone knows a full answer, but I think that if anybody's going to figure it out, I think we have a good shot.
Yeah, interesting times indeed. I mean, you're talking about changing an entire culture is what you're talking about doing, and I guess we'll see, but it sure is fun to talk about.
Absolutely.
Yeah. All right. Well, Ricky, I appreciate you coming by and sharing your thoughts, and thanks for presenting at the Innovator Summit.
Fantastic. This was a lot of fun. Thank you.
Thanks.